this session. So now I will discuss the second unit of the topic health and disease. So these are the objectives of this topic I have told you earlier. So this is the second unit, concept of disease, and it covers competencies 1.3 and 1.4. And here I will describe the concept of disease, the theories of causation of disease, then the epidemiological triad, that is agent, host and environment, and also the multifactorial etiology of disease, and finally the natural history of disease. So what is disease? Disease literally means without ease, dis-ease, that is no ease. So something is wrong with the bodily function. And there are some related terms with disease like illness, sickness, etc. So what is the difference? Let us understand the terms. So disease means physiological or psychological dysfunction. That means the body or mind is not functioning properly. Illness is the subjective state of the individual who has the disease. That is the way he feels. He doesn't feel well, so he is feeling ill. That is illness. And because of this disease, he is feeling ill, and because of that, he cannot do something. So this is the role that he assumes, that is sickness, so social dysfunction. So that is the role that he has assumed because he is feeling ill, because he has a disease. So that is sickness finally. So these are the definitions of these terms, and this is how you have to understand and you have to know this. So disease causation. There are various theories of disease causation. In olden days, there were the old theories. Then came the germ theory of disease, epidemiological triad, and finally the theory of multifactorial causation. I'll discuss all these theories. So the old theories, long back, early times, there were the supernatural theories. That means people believed that disease occurs due to past sins and due to wrath of God. God is angry, so God curses, and there is an evil eye and the person falls ill. And so there was no treatment at that time, obviously. So that time they used to resort to magic, witchcraft, etc. for taking care, doing something for the diseased person. Then gradually things changed, understanding happened, and in different countries, different systems of medicine developed. And more or less these are similar in the concept. So in India, the Ayurveda developed. This is the indigenous system of medicine of our country. So, and it was quite advanced in all aspects. So this considered disease due to imbalance of three doshas, that is air, bile and mucus. So these three elements, there is imbalance of these three, no harmony of these three, and that is why this is known as three doshas or problems. So this is Ayurveda. Similarly, in Greek medicine, they followed the theory of four humors, that is phlegm, yellow bile, blood and black bile. And harmony of all these maintains good health, and if there is imbalance, the person becomes diseased. Similarly, in Chinese medicine, they have the concept of two principles, that is yang and yin. Yang represents the masculine principle and yin represents the feminine principle. And again, harmony between these two principles keeps a person healthy, otherwise the person develops disease. Then with development of science, more understanding happened and the germ theory of diseases was proposed. And this is known as the golden era of medicine because lots of discoveries happened during this period. So of those bacteria, discovery of bacteria was a very important feat. So this was discovered as a cause of disease, that is a microorganism is the cause of a particular disease. So this was established as the germ theory. That means specific microbe or germ has to be present for the disease to occur. So in diseased people, this germ is present. That means this germ is causing this disease. So this was known as the germ theory of disease. So in 1860, Louis Pasteur demonstrated that there are bacteria in the air, and these, if inhaled, ingested, causes disease. So again, this germ is this bacteria is the cause of the disease. In 1877, Robert Koch discovered the first bacteria, saw the bacteria under microscope, that is Bacillus anthracis, that causes anthrax. And he formulated the famous Koch's postulates. So according to this germ theory, there is a disease agent which gets into man and causes the disease. So what is Koch's postulates? So these are the four conditions or criteria that have to be met for calling that this germ or this bacteria, this microorganism is the cause of this disease. So these 4 points in Koch's postulates are, first of all, when there is a diseased person, a disease has happened, the causative microorganism must be present in the diseased individual and it will be absent in the healthy individual. Second point is that this microorganism can be isolated from the diseased individual and can be grown in laboratory, can be cultured in the laboratory. Then thirdly, this microorganism that has been cultured in the laboratory, if that is injected into a healthy laboratory animal, it will produce the disease in the animal, that same disease, and it will be similar to that. And now the fourth is that this microorganism can be re-isolated from the diseased animal. And this bacteria or microorganism that has been re-isolated from this laboratory animal will be the same as the bacteria that was isolated from the diseased individual. So all these criteria together is known as Koch's postulates. And if a bacteria and a disease meet these 4 criteria, it is said to be the cause of that disease. The third theory is the epidemiological triad. This came with the ecological concept because it was understood that it is not only the agent, the bacteria is the agent. So it is not only the bacteria, because the bacteria is present in the environment and many people are exposed to that, but only some are developing disease. Why so? So it was realized that the environment also had a great and important role to play. So that is why it came as the epidemiological triad, that is a triad of 3 factors. What are those? The agent, the host and the environment. So everything should be together responsible for this. So if the agent is present and the susceptible host is there, but if the environment is very good, it may not happen. But the environment should be favorable for the bacteria to thrive and infect the host, and then only the disease will occur. Then came the theory of multifactorial causation, because it was realized that not only the agent, host and environment, there are many factors, not only one bacteria that is the agent, there are multiple factors which all influence together the causation of disease. So these factors may be physical, mental, emotional factors of the individual himself, or it may be the behavior and lifestyle conditions of the individual, or it can be the family and the community to which he belongs, or the physical and biological environment to which he is exposed, and also the social and cultural practices that he follows. So all these together determine whether the person will get the disease or not. Now I'll explain the epidemiological triad. So this is the triad: agent, host and environment, a very simple model. So this is what happens. The agent is there, host is there and environment is there. If they are in equilibrium, the person will remain healthy. If it is disbalanced, there is no equilibrium, it is lost, then it will become tilt on one side and the person will get the disease. So this was the simple model that expressed through agent, host and environment. Then an advanced model or triangle of epidemiology was also proposed. So here, instead of the agent, it is said to be all causative factors, because by this time we have understood the multifactorial causation of disease. So all these causative factors, these are the agent component or agent factors. Then instead of only the individual, the susceptible host, we have the entire population or community who are exposed to it. So that is the host. And the environment here, not only the physical environment, but the behavioral, cultural, physical, ecological, everything together. So that is the environment. And in addition to this, there is the time also, the incubation period, which is also very important in determining whether the disease condition, or the period of illness, or the period of communicability, etc. So a time factor is also there. So the characteristics of the agent, host and environment. Agent is any biological, physical, chemical, mechanical forces. So initially the concept was that the agent is only a bacteria or a microorganism. But later it was realized that not only biological, there may be other agents also, other entities which also served as agents, like say physical. So heat, cold, etc. also can cause disease. Chemical, say fumes, toxic gases, acids or metals, they can also cause disease. Mechanical, that is pressure, friction, etc., can also cause disease. So all these forces, these can all be called as agents. So this is the agent, and they must be present for the disease to occur. But the presence of agent alone does not ensure that the disease will definitely occur, because there are other factors also, the environmental factors. And so variety of factors also affect, and for the agent also, the microbial agent, the organism's pathogenicity is very important. How virulent, how capable is that organism to produce the disease? And secondly, the dose of exposure, to what extent the individual had been exposed to this agent. So these are the agent factors. So biological agents I told you about, say bacteria, virus, parasite, etc. Nutrients, these are also agents, because excess of some nutrients can cause disease, like say obesity caused by excess of macronutrients, which I will discuss later on. Then deficiency of some nutrient like vitamin A deficiency or iron deficiency, these causes disease. So nutrients are also agents, or can be physical, as I told you, heat, cold, etc. Chemical, I told you, mechanical. Social factors also can be agents, that is, say child marriage, that can act as a cause for developing, so young child getting married and becoming pregnant, and there may be maternal death, there may be child death. So that is the disease that occurs due to the cause, that is the child marriage. So social factors can also act as agents. Now the host is the human who can get the disease. So these are factors intrinsic to the host, that is, these are inherent in the host, the risk factors of the host, which can influence causation of a disease. So these factors can be genetic composition of the individual, it can be the demographic factors, that is age, like extremes of age, they are more susceptible to severe disease or mortality. Then nutritional and immunological status of the person, presence of other diseases, or the medications that the person is taking, those can also influence occurrence of other diseases. Then the lifestyle factors like the diet, unhealthy diet, physical inactivity, or say substance abuse in the form of say tobacco, alcohol. So those also are intrinsic factors which influence causation of disease. Then the environment. So these are the extrinsic factors, that is all that is external to the human host. So these include physical factors like the terrain of the place, the geology, the climate of the place. The biological factors like the insects that transmit the agent, like vectors, say mosquito transmitting malaria, housefly transmitting diarrheal diseases, etc. Then socioeconomic factors like overcrowding, sanitation, availability of health services is also important. So these factors, these are all the environmental factors that influence disease causation. Next is multifactorial causation and web of causation. So multifactorial causation means, as I explained earlier, that means many factors together, they are affecting not only one disease agent and the outcome. There are many factors that influence disease causation. And this is more important in non-communicable diseases like diabetes, coronary heart disease, etc. So here many factors like unhealthy diet, physical inactivity, substance abuse, etc. all influence disease causation. Now, web of causation is a concept from this, that means these factors, so this is the person and these are the different factors. So these factors influence disease causation, that is multifactorial causation. While web of causation says that these factors also interact amongst themselves and forms a big web, and that is how the disease is caused. So I will show this to you how it is happening. So this is web of causation. So if you look into it, so the first thing is change in lifestyle. So where there is change in lifestyle, what change? The person is taking a lot of junk food intake. The person has a lot of stress in life. So because of the junk food intake, he is developing obesity. Now stress, so to alleviate the stress, he is smoking tobacco. And for stress, he is not going out for walks, etc. So lack of physical activity is also happening. Now, lack of physical activity is again giving rise to obesity. Obesity is giving rise to hyperlipidemia and coronary atherosclerosis. That is leading to coronary occlusion. That means the coronary arteries are blocked. Now, here smoking leads to blood clotting irregularities. So, clotting mechanism is disturbed. As a result, there is increase of catecholamines and thrombolytic activities. So thrombus forms, that means blood clots form, which again block the coronary arteries, and ultimately that leads to myocardial infarction or heart attack. So this is the outcome. The initial cause is the change in lifestyle, and the outcome is myocardial infarction. But this has happened through a very complex process. Many factors are affecting, and these are interacting amongst themselves also, and ultimately leading to the outcome. So this is web of causation. So next is natural history of disease. So this means the way a disease will progress in an individual over time in the absence of any intervention to stop the disease, like treatment. In absence of that, how the disease will progress. So this is generally has to be seen in an unknown disease in the initial phase. Otherwise, obviously, we don't stop the treatment and wait and watch what will happen. So this is done for the new disease. We see how it is going. In the meantime, we try. Like in the present context, you can see COVID-19 has developed. We were unaware of what this disease is like. What are the interventions that can stop the disease or prevent the disease, treat the disease or prevent complications. So when initially it happened, it was symptomatic treatment and trial of different types of treatment it was happening. So we saw how it is progressing. So now we know what the clinical features are, how much time, what is the incubation period, etc. So that is natural history of disease, that how the disease progresses over time. So without medical intervention, the outcome can be recovery of the patient. It can be recovery with disability, or it can even lead to death. So understanding natural history of disease is very important, because we want to know how it is going through, and we want to know how and where, what intervention we can give to arrest the disease or prevent the disease. So this explains first the stage of susceptibility. So the person is susceptible to the disease, and this is the pre-pathogenesis phase, that means man in the midst of disease. Then the exposure happens. So after the exposure happens, the person acquires the disease. So here the subclinical stage, that means no symptoms. Pathologic changes are happening within the body, but there are no symptoms or no manifestation. So this is the subclinical stage. Next happens the onset of symptoms. So at this point, the symptoms start appearing, and this is the stage of clinical disease. That means it has manifested, and the individual knows and reports to the health system, and it has been identified. So from the onset of symptoms, this is the usual time of diagnosis, because immediately as the person gets to know, doesn't come running to the health system. So he takes some time, or that is the time. So then this is the usual time of diagnosis when we know that this person has the disease. And then treatment is initiated or not. Then the stage of recovery, disability or death happens. So natural history of disease in man consists of two phases. One is the pre-pathogenesis phase, that means the process in the environment. And then the disease agent enters the man, and the pathogenesis phase starts, that is the process in man. So in the pre-pathogenesis phase, this is the preliminary phase before the disease onset. So here the disease agent has not yet entered man, and as I told you, man in the midst of disease. That means in the environment there are the agents, the environment is conducive to development of the disease, and the man is there, but the disease has not yet entered man. So this is pre-pathogenesis phase. Then comes the pathogenesis phase, which starts with the entry of disease agent in the susceptible host. So the agent, the bacteria, they enter the host, so many had entered, and they multiply, and many more. So the dose of exposure, as I had said, so a whole lot of bacteria or the agent are there within the body, and they affect the tissues and the cells, and they induce the changes, the pathophysiological changes and biochemical changes happen. And then the disease progresses and manifestations start appearing, and after that it may progress to complication and the outcome. The pathogenesis phase can also be divided into early and late pathogenesis phase, and finally the outcome happens. So this is the model: period of pre-pathogenesis and period of pathogenesis. So in the pre-pathogenesis phase, the host has not yet been involved, and there is the agent in the environment is conducive, and the host is also there susceptible, but it has not entered man. So next, when it enters the man, the course of disease in man starts. So these are there. There is interaction between agent, host and environment, and the disease process starts, and then the early pathogenesis, that is initially the asymptomatic phase starts, and after that the symptomatic phase, and then the late pathogenesis or full-blown disease. And final outcome can be recovery, disability or death. So with this I end this session. I'll sum up what I discussed. I discussed some terms with you. Disease, illness and sickness. I told you about the differences between these. Then I told you about some theories of disease causation, that is the old theories, the germ theory of disease, epidemiological triad, theory of multifactorial causation and web of causation. And then finally I discussed the natural history of disease, the pre-pathogenesis phase and the pathogenesis phase. So again, there are some questions for you to check your progress and the answer keys given. So with this I end this session. I hope you've enjoyed this session and I hope you've understood it all. Thank you.